Let's explore the phases of the cardiac cycle, the sequence of events that happens every time your heart beats. In less than 1 second, the heart goes through four main phases: ventricular filling, isovolumetric contraction, ventricular ejection, and isovolumetric relaxation. First, ventricular filling. During diastole, the ventricles relax and expand. As they expand, their pressure falls below the pressure in the atria. This pressure difference causes the atrioventricular, or AV, valves to open, allowing blood to flow from the atria into the ventricles. Ventricular filling occurs in 3 steps. The first is rapid filling, when blood rushes quickly into the ventricles. The second phase is called diastasis, where filling slows down. Near the end of diastasis, the P wave appears on the ECG, signaling atrial depolarization. Finally, atrial systole occurs. The atria contract and push the last portion of blood into the ventricles. The right atrium contracts slightly before the left because it receives the signal first from the SA node. By the end of ventricular filling, each ventricle contains about 130 milliliters of blood. This is called the end diastolic volume, or EDV. Next comes isovolumetric contraction. The atria relax and remain in diastole for the rest of the cycle. Meanwhile, the ventricles depolarize, producing the QRS complex on the ECG, and begin to contract. As pressure rises, blood pushes back against the AV valves, causing them to close. This produces the first heart sound, S1. During this phase, all 4 valves are closed. The ventricles are contracting, but no blood is leaving. Because the volume stays the same, this phase is called isovolumetric contraction. Then we move into ventricular ejection. When ventricular pressure rises above arterial pressure, the semilunar valves open and blood is ejected into the arteries. In the left ventricle, pressure peaks around 120 millimeters of mercury and about 25 in the right ventricle. Not all the blood is pumped out. At rest, about 70 milliliters are ejected. This is called the stroke volume. That's roughly 54% of the EDV, known as the ejection fraction. The remaining 60 milliliters is the end systolic volume, or ESV. During intense exercise, the ejection fraction can rise as high as 90%, an important indicator of heart health. Finally, isovolumetric relaxation. As the T wave ends, the ventricles begin to relax. Blood briefly flows backward toward the heart, causing the semilunar valves to close and producing the second heart sound, S2. Again, all valves are closed, so the volume does not change. When ventricular pressure falls below atrial pressure, the AV valves open, and the cycle begins again. And that's the cardiac cycle. 4 precise phases that keep blood moving with every beat.